sorry. Excuse all of the noise through this video because the dogs are just too much, too cute. You're disturbing my light ray. Okay. Hello everyone, my name is Jennifer. I'm a registered Australian physiotherapist and antenatal Pilates instructor in the Canberra region. If you are local and you'd like to book an appointment, head on over to our website. I'll leave a link down below. If you want answers to any little question or to get in contact some other way, feel free to hit us up on Facebook or Instagram. We are Physio for Happy Healthy Pregnancy, the same way it's spelled here. So without further ado, let's get into it. So ladies, let's talk pelvic floor. Today I'm going to discuss with you just what is your pelvic floor, what does it do, how to know it's doing what it's supposed to do, how to strengthen it, and some common pelvic floor myths that are preventing you from understanding a little bit more about how your body works. So as always, please bear in mind that this is not a substitute for individual tailored medical advice. If you are concerned about any of the advice I'm going to give you, please make an appointment with an obstetrician or a women's health physiotherapist, or speak to your midwife. So what is the pelvic floor? The pelvic floor is a group of muscles at the bottom of the pelvis. They hold and support the low-lying pelvic organs, namely the bowel, bladder, and the uterus. The whole system functions similar to a tight trampoline with 3 openings. At the front, the urethra, in the center, the vagina, and at the back, the anus. The skin between the vagina and the anus is called the perineum. You might have heard about this. It very commonly tears during childbirth, but don't worry. Due to its position in the body, it heals very quickly and very well. After pregnancy, the tight trampoline often resembles a little bit more of a saggy hammock. The good news is that this is the most natural process in the world and can absolutely be returned to its original condition with proper pelvic floor rehab. So, the pelvic floor works with the deep abdominal muscles to hold and support these pelvic organs. This assists in maintaining bladder and bowel continence and plays a role in sexual function and satisfaction. So, how can you tell if something is not working quite the way it should? Well, if you've just given birth, it's a pretty safe bet that everything needs just a little bit of strengthening. If you're currently pregnant or haven't taken that step yet, some signs that indicate that something's not functioning quite right could be things like stress incontinence. Are you leaking when you cough or sneeze or jump or run? Frequency, that is, needing to go to the toilet more often than you normally would. A normal value for toileting is 4 to 6 times per day, not including the first morning pee. But, as with every statistic, there is a little bit of room for individual variation here. So base it on what is normal for you and if that's changed. Urgency, that being a sudden, unstoppable urge to urinate coming seemingly out of nowhere. The urge should build gradually over a period of half an hour to hours. A heaviness or a dragging sensation in the pelvis or vagina. Not feeling empty after urinating, or experiencing the urge to pee return after you stand up from the toilet. Painful sex, or constipation, especially if it's not changed by dietary modification. So, how do you activate your pelvic floor? And why should you activate your pelvic floor? Well, the pelvic floor is just like any other muscle. You need to work it to strengthen it. You wouldn't expect your biceps to get big and strong and support your shoulders properly if you didn't exercise them. Why would you expect the same from your pelvic floor? A pelvic floor activation looks like turning the pelvic floor from that saggy hammock back into the tight trampoline. So that's a lift and squeeze. It can be quite challenging to get, especially if you've never tried before. So some things that you can do to kind of cue yourself would be to think about lifting and squeezing, or squeezing and lifting. Closing around the front and back passages as if you're trying to stop the flow of urine or stop yourself from passing wind. That cue can help and does help a lot of women. Another way to visualize is almost imagining you've got an elevator there, and you start by closing the doors, closing around the passages, and then lifting up. And you can imagine that the elevator has 10 levels, 10 being the highest activation you can, and then level 1 being about 10%. So now you know how to work your pelvic floor. What exactly do you do from there? How do you strengthen it? Should you just hold your pelvic floor on all the time and hope that works? Well, no. A very basic way to strengthen your pelvic floor would be 10 quick flicks and 3 long holds. Quick flicks ideally being you turn your pelvic floor on as hard as you can quickly and then relax quickly. The idea of this is to mimic your body's response to increased intra-abdominal pressure. So, for example, when you sneeze, the pressure in your abdomen increases and your pelvic floor needs to come on to keep you continent. So you should be doing 10 quick flicks every day. If you can't remember every day and you only manage 5 times a week, that should be absolutely fine. Now, part 2 of the exercises should be long holds. As a general rule, you should only expect yourself to be able to hold a pelvic floor activation for the number of seconds that is the weeks old your baby is. So if your baby is 3 weeks old, you should be able to hold it for 3 seconds. If your baby's 10 weeks old, you should be able to hold it for 10 seconds. There is an upper limit on that, and that upper limit is about 10 weeks. Ideally, we'd love your pelvic floor to be even stronger than that, but 10 seconds should suit you functionally fine. With these long holds, we don't want you to be holding an absolute max activation, just to about 60%, or about level 6 on the elevator if that cue worked for you before. So, now you know a little bit about what is true about the pelvic floor. Let's talk about some common pelvic floor myths. Number 1, men don't have a pelvic floor. Actually, yes they do. Men's anatomy, as you might imagine, functions slightly differently. One key difference is that men only have 2 openings in the pelvic floor. For men, the pelvic floor helps to maintain urinary and fecal continence, just as it does in women, but it also helps to prevent erectile dysfunction. Isn't that interesting? Some common ways to cue pelvic floor activation in men are: imagine you're walking into cold water and lift your crown jewels. Imagine you were trying to hold in wind or to stop the flow of urine, just like with women. Myth number 2. Only women who are pregnant or have had kids experience issues with their pelvic floor. No. No, this one is also absolutely not true. The pelvic floor can weaken just like any other muscle in your body. Other things that can increase the pressure on your pelvic floor, causing it to stretch, include chronic coughing, sneezing, chronic constipation, or sports such as trampolining or running. Basically, pelvic floor dysfunction isn't limited to only a weak pelvic floor. The pelvic floor can also be really tight, leading to symptoms such as painful sex, or difficulty passing stools, or back or abdominal tightness and pain. Myth number 3. Kegels are the only way to strengthen your pelvic floor. This is also definitely a no. A Kegel is a small weighted ball that you insert into your vagina and you use your pelvic floor to lift and lower it, rather like a weighted bicep curl. This kind of exercise is not right for most women, partially because most women will never need this kind of strength functionally. The best way to strengthen the pelvic floor is unweighted. This is because if you're using the Kegel incorrectly, or you do not have the strength needed to lift the weight, you'll be stretching and weakening your pelvic floor similar to the way that a baby sitting on the pelvic floor would. Also, as mentioned, most women would never need that kind of strength functionally. If your pelvic floor only ever needs to hold up your internal organs, why would you make it try and hold up other things? Number 4, stopping and starting the flow of urine is a good way of strengthening the pelvic floor. Look, it has its place. If a woman is really struggling to feel what a pelvic floor activation feels like, a good place to start is stopping and starting the flow of urine a couple of times, just to feel what it feels like. However, if you continue to practice this, you put yourself at risk of incomplete emptying or urinary retention. And this is not good. It increases your risk of things like UTIs. Number 5. It is normal to leak when you sneeze after having a baby. Just pop in a liner. This myth makes me really mad. It is not normal. Pain and dysfunction should never be considered normal, especially after something as normal and natural as pregnancy and childbirth. Incontinence is never normal, no matter how mild. You should absolutely seek guidance from a pelvic floor physiotherapist. Also, side note, if you are using liners, you should be mindful of a few things. 1, it is normal to want to get back to your everyday activities and not let a little bit of leaking hold you back. But please still do be mindful that you are listening to your body. If a certain activity like standing all day or running gives you a lot of leaking, your body is probably trying to tell you it's not ready for that yet, and continuing to push it might actually be making the problem worse. Again, please get checked out by Women's Health Physio. They can give you some clarity on activities that might be strengthening your pelvic floor and what activities might actually be doing the opposite. The second thing being that if you're using a liner, make sure you're using a continence liner, not a period liner. A continence liner will be beside the period liners in the supermarket. You'll know you're in the right section when you see men, like darker packaging for men next to it. Of course, you don't have to use the men's liners, you can use a women's one, but it should say continence on the packet. This is really, really important because the two types of liners wick water differently, and so you'll put yourself at high risk of things like UTIs if you're using a period liner. Myth number 6. Painful sex is normal for some women. Also, no. Sex should be pleasurable for both parties. If sex is painful, this can be a sign of a tight pelvic floor or an inadequate lubrication or foreplay. If you're using lots of water-based lubricant and it still isn't helping, please go see a pelvic floor physio. They can help you stretch out those tight muscles. Additionally, if you're experiencing pain during sex that is not related to tight pelvic floor, it can be a sign of something more sinister, such as a prolapse. Go to a women's health physio. They can diagnose you for such things. Also, it might be worth speaking to your doctor about it. It can also be a sign of conditions such as endometriosis or an inflammation of the vaginal wall. Myth number 7. I had a cesarean, so I don't need to worry about my pelvic floor. Yes, you do. You do need to worry about your pelvic floor. A combination of the weight of the baby sitting on your pelvic floor for 9 months and all of those lovely hormones that soften your pelvis so that the baby has enough room to come out really do weaken your pelvic floor. It is so important that you strengthen that back up to avoid things like stress incontinence. Number 8. I can't activate my pelvic floor. Yes, you can. If you can hold in a pee or stop yourself from passing wind, you absolutely can. If you're having trouble feeling yourself activate that pelvic floor muscle, it is likely just because your brain isn't used to doing it consciously. Keep trying. I promise you will get there. You can always try stopping the flow of urine once or twice to see what it feels like. If you're really unsure, reach out to a women's health physio. They can absolutely help you. Number 9. I've tried pelvic floor exercises. They don't do anything. Girl, I feel your frustration. It takes 4 to 6 weeks of religiously completing your exercises, at least 5 times a week, with good technique to make a functional difference. I promise they do work. If you're doing them consistently with good technique, I promise that they do. Again, please keep in mind, if you've had a week or 2 or a few days of activity that's put extra stress on your pelvic floor, such as lots of standing exercise or getting sick, meaning that you cough and sneeze a lot more than you normally would, your pelvic floor might suffer a little bit of a backslide in your progress. This does not mean that the exercise is not working. It is still stopping you from losing your progress faster than you otherwise would have, and you will start to see gains again as soon as these extra stresses are removed. So ladies, that brings us to the end of this one. Please like the video if you enjoyed it. It really helps the channel. If you have some friends who you think might like to hear this message, feel free to share this video. For more tidbits of advice and information, make sure you follow us on Instagram and Facebook at Physio for Happy Healthy Pregnancy, the same way it's written here. And for more information on pregnancy, continence, women's health, and everything in between, every second Friday, Please subscribe. This is Jennifer signing off and wishing you a happy, healthy pregnancy.